So let's have a look at one or two classic symptoms that's associated with each of the diagnoses that we've looked at in our chest pain schema. Before we start though, a warning. Not everybody who has the condition that we're talking about will have these classic symptoms. And similarly, not everybody with the classic symptoms will have the condition. That's one of the great things about medicine. There are no absolutes. You may be stuck having to balance probabilities, and we'll learn more about doing that balancing later on. Just remember that not everybody who has a crushing central chest pain is having a heart attack, and not everybody who's having a heart attack will have crushing central chest pain. Let's start with the heart. People with myocardial infarction can typically have pain that radiates, that is, that moves to either their shoulders or their arms. People with pericarditis can typically have pain that is relieved when they move forward or when they're leaning forward. I think about this in terms of that lining of the heart. It may be rubbing and irritating more if they're leaning back, and rubbing and irritating less when they're leaning forward. People with aortic dissection can have pain that they describe as tearing or ripping, and they'll feel it sometimes in their upper back. Moving to the esophagus, people with gastroesophageal reflux disease or GERD will typically describe their pain as heartburn. It will also often be related to meals. People with esophageal spasm may also have their pain related to meals, and they'll report difficulty swallowing. People who have chest pain related to pneumonia will often have the chest pain get worse with a deep breath. People with musculoskeletal problems, or MSK problems, will often have painful spots that, if you push on, will make the chest pain worse. We call that getting worse with palpation. Or they'll have pain that gets worse with certain movements of their chest wall. And finally, people with panic disorder will often have chest pain that goes along with the classic feeling of impending doom or impending death. So that's it for classic symptoms. Now remember, they're not absolute, but they are typical, and that's what makes them a good place to start when you're sorting through the various diagnoses that are part of our chest pain schema.